here we go, treating bipolar with antidepressants. Ineffective, all right, cause cycle acceleration, which means it gets worse over time, okay, can provoke mania. Yet, if you look at classes of medications, which class of medication is used the most in the United States to treat bipolar disorder? Antidepressants. You know why? Misdiagnosis and treatment of primary care. And I mean, maybe I'm being redundant here. This is not just an academic question of getting the right answer. This hurts people. And a lot of people, it doesn't cause, it can cause mania, okay? But for a lot of people, it just doesn't work, and they keep taking it, and guess what? They're getting depressed more often, and it's more severe. And 10 years later, oh my God, this person's got bipolar, and they've already had 10 years of exposure. Okay, a couple more slides and then we'll stop. Look at, these are two studies, and they're the best around in terms of looking at it over a longer span of time. And 13-year follow-up studies, these are people with bipolar 1, classic manic depressive illness that has manias and depressions, okay? And look at this. These are people in treatment who are being followed up for 13 years. In treatment, okay? 47% of the weeks, so 47% of their life during these 13 years, they were symptomatic. And here's the breakdown. And so what we have here basically is about 2/3 of the times they're symptomatic, it's depression, and about 1/3 is some version of mania. With bipolar 2, it's even worse, and it's worse for a couple of reasons, okay? Now, first off, some people say, well, bipolar 2 is a less severe version, and in one respect that's true, because they don't have these horrible manic episodes, which can be catastrophic. Okay, they can ruin people's lives. But over the long haul, you have higher suicide rates and higher divorce rates with bipolar 2. And the reason for this is because of this. Look at this. They are symptomatic even more of the time, okay? And almost all of that's depression. More than 50% of the time, they're in states of depression. And that really takes a toll in terms of marriages and increasing suicide risk. And if you happen to have hypercortisolemia along with your depressions, and you're walking around being exposed to toxic levels of cortisol for years. And that's why you have brain damage with bipolar disorder that's significant, and also, did I mention last time vascular disease? Did I mention that in our last class? Hypercortisolemia? Yeah, and they have twice the death rate from heart attacks than they do in the general population. Okay, diagnostic issues. Okay, let's go through these and then we'll stop. High index of suspicion. First off, this is really important to look at, is family history, okay? Because it's hard to find someone who's bipolar that doesn't have a large number of relatives that have severe mood disorders, okay? Now, obviously, sometimes people don't know about their relatives. Most people don't know if their great aunt had bipolar disorder, but they might know that, yeah, old Uncle Tom, boy, he was a drunk. He died of cirrhosis when he was like 40. He's in and out of the hospital. Oh yeah, my great-grandmother, she was in and out of state hospitals. Or great-aunt Susie killed herself when she was 32. Now, none of these alone necessarily means that they have bipolar. But you get a family history, it's like a whole bunch of these people are having a bunch of this stuff. It increases your index of suspicion. The next thing is hypothermia, which is a chronic hypomania. And if I had to be stricken by any psychiatric disorder, this would be my choice, okay? These people, I know somebody like this. My wife's best friend has this, and she's outgoing and gregarious and sleeps 5 hours a night and is never sleepy. And, it's like if you add some ambition and IQ points in here, look out. I mean, these people go to town. And they don't need treatment. They don't come in and say, God, help me. They do have her come in for marriage counseling a lot of times, because one problem is that they tend to be kind of irritable. They're upbeat, but they're also kind of irritable. But they really get frustrated when people can't kind of keep up with them. Well, what's the matter with you? You don't want to go out for the 6th time this week and go dancing? You know, that kind of thing. Okay. But the reason this is here is not because this by itself is psychopathology, but it counts, okay? So when and it's not unusual that you get a kid who's got bipolar and their dad's got this, okay? So it's coming out of that same genetic vulnerability. Okay, let's see, childhood onset of depression, postpartum onset, post-hysterectomy. If the depressions occur early in life, or if they follow here, especially if you don't have a history of premenstrual dysphoria. A lot of times people's first episode of bipolar is after they give birth to a baby. Treatment resistant to antidepressants. Most people come in and say, I've taken all these antidepressants and none of them work. 4 out of 5 of them never took the drugs long enough or at high enough doses. What we're talking about here is they've taken really hefty doses for weeks, and they've tried 3 different drugs, and none of them work. That's a huge red flag. Okay? Sometimes, history of positive response to antidepressants, but then it poops out after a month or 2. It's not clear what's going on here. Probably placebo response to their depression. Now, most people with seasonal affective disorder don't have bipolar, but a lot of people who have bipolar have seasonal mood changes. Okay? Major depression with racing thoughts, psychotic symptoms with their depression. Okay? If a person is having episodes of depression that occur more than 1 time a year, almost all of them have bipolar. They have bipolar 3, we'll talk about next time. And then finally, I've already talked about this, are atypical symptoms. You see hypersomnia, sleeping 12 hours a day, tired all the time, often increased appetite and weight gain. A triad, but especially hypersomnia. Again, this was a European study, but there's been one in the United States. Same result. Basically, about 4 out of 5 of them have bipolar 2. Okay? So that's kind of the checklist to go through. And the 2 things that really stand out big are family history and atypical symptoms. But I think before you give an antidepressant to anybody, you've got to walk through and really check and make sure. And remember, a lot of these bipolar folks have had something bad happen, you know? Their marriage breaks up, they lose their house for foreclosure or something, they get depressed. It looks like a reactive depression. Can happen just as likely in someone with bipolar as somebody who's got unipolar. So the fact that it's in response to a life stressor does not mean they don't have bipolar. Okay?